review a transverse abdominis strengthening progression. So the most important thing is that we get to contract the right musculature when we're performing a TA contraction. So the way I like to teach this is that we find that bone that's popping out on the hip. We call this the ASIS. Good, you found the one on the other side. We're gonna go about 1/2 inch toward the midline and about 1/2 inch lower down. So we're palpating right in there, nice light pressure. I want you to draw your stomach in toward your spine, hollow out your stomach, and you feel those muscles really popping out into your fingertips, right? Perfect, I feel that there. So I want you to just hold those really tight, hold that muscle, hold that contraction while you breathe. So the first and most important thing is that we're able to contract the transverse abdominis while we keep breathing, okay? So you don't wanna hold your breath, you don't wanna do like what we call a Valsalva or really create a lot of intra-abdominal pressure. Just keep that trained, keep that tight, and keep breathing, okay? So now that we're there, we can start little progressions in order to challenge the TA muscles with some leg movement. So the first thing we'll do is some knee fallouts. So Tier's gonna demonstrate for us here. So just slowly fall out, come back in. Just keeping that core really tight, fall out, come back in. Really keeping that core tight. You're always watching to make sure you keep breathing, okay? Once we move past that, we can do little marches. Okay, so we're keeping that tight, good, and we're just marching up and down really slowly, really concentrating on your breathing, focusing on keeping that core nice and tight, feeling those muscles pop out into the fingertips. Once this becomes really easy, you can do full leg extensions, so let's see some of those. Good, good, come back and keep going. So you can start kicking those legs high up in the air with full extension, and as you get a little stronger, really hover right above the table, right? Okay, now let's do some low ones. So really low down, there you go, and back. Keeping that core tight, keeping that core really strong while you're breathing, you're not holding your breath. Okay, take a little break. Okay, once those become easy, we can get into the 90-90 position. Okay, so keep it tight, other leg up too, good. Now we have 90 degrees at the hips, 90 degrees at the knees, and we're gonna slowly march down with a heel tap. So tap one heel, good, come back up. Tap another heel, come back up. Good, and you can do about 3 or 4 of these. Every 3 or 4, bring the legs back down and take a rest. So let's do that, take a rest, good. The next progression at the 90-90 is tighten up, come back up. We're gonna do, let's get all the way up into 90-90, good. Now we're gonna do full leg drags all the way down, so one at a time. All full extension and back, good. Full extension and back. And you can progress all the way up to doing about 3 or 4 times with each leg before you take a rest. So so we go down, up, down, up, down, up, down, up 3 times, and then bring the feet all the way down. Take a deep breath, relax the contraction, recontract, and come right back up into 90-90. Good, and then you can do another set. Good. Excellent, keeping that tight. Perfect. Okay, and it's important to not do these too fast because you really want to control the pelvis, control the TA muscles, and keep breathing. If you do these too fast, you're really going to lose that pelvic tilt. You're going to come out of that neutral spine position. You're going to lose that TA contraction. So come on down and relax. Good.